I will give you the bone and also the articulated pelvis. So you can see now this is the single hip bone, and this is an articulated pelvis. Articulated pelvis. Two hip bones, one sacrum that make up the pelvis. Now what I want to stress is this. See, you have seen there are many muscles from the hip bone. It arises to form the wall of the muscles arising from the hip bone. They are having their attachment in the hip bone that covers the whole surface. You have to make up a concept that now you just hold it like this. Skeletal. You hold it like this. If you are given the hip bone, articulated pelvis, if you are given this specimen, okay. Now I will just show you the sacrum will be in the posterior aspect. Sacrum has, you don't hold it like this. পড়ে যাবে না, ওইখানে টানানো তো ঠিক হবে, এটা পড়ে যাবে না, কি উল্টে যাবে, আমি তো ধরবো, তো ওইখানে লাগিয়ে দে, আমি তো ধরবো। এই উল্টে গেল, ওদিকে ঘুরে but secured. Once I show you the hip bone gross, by 5 of you go there and see. Not now, let me tell you. Okay, now, and one thing, see, this is not in the, it will be on the posterior aspect. Because when you are in exam, you are in tension, naturally you will pick up and suddenly you hold it like this. No. You hold it like this. Now, you see, what is this socket? You have, knowing because of the, I told you the hip joint. Now, it is articulating the acetabular cavity. Okay. Now, it is on the lateral side. So, this is also in the lateral side. If I am holding it like this, then it is on the lateral side. If you are given a single hip bone, I am giving you, see that this I have just removed it like this. If you have it like this, no. It's on the lateral side. Acetabular cavity is in this thing. It articulates with the head of the femur to form the hip joint. Now, if you hold it like this, you hold it like this. In between the sacrum comes. Now, see, it's an irregular bone. That's why known as innominate bone. It has an external surface and internal surface. This is known also the iliac surface. But one important part is this, the articulation of the sacrum with the hip bone. You have a ear-shaped articular surface. Ear-shaped articular surface. Okay? Ear-shaped. আমি মোটা মোটা কথা বলবো. Rest you have to read and the finer details. If you cannot identify a bone and which side it is, then you cannot proceed. Now, the hip bone has a foramen. This is known as the obturator foramen. It has an anterior spine, posterior spine. Okay. Now, this is the ischial tuberosity. Ischial tuberosity. You hold your own pachu. So, see, now, the posterior, this is the gluteal region. The gluteal region, what happens? There are some muscles. If you stand up or sit, but stand up and you can make a taut, tight করে দিতে পারবে. তুমি feel করতে পারবে. I'm saying when you are correlating with the bones, you can feel it. You feel it. So there are three muscles, gluteus maximus, medius and minimus. Okay. It is all attached in there. This is the anterior superior iliac spine, posterior superior iliac spine. This is the ischial tuberosity, the ischial spine. This is the acetabular cavity. It has an articular surface. And now, from the iliac crest, the muscles are going like this. External oblique, internal oblique, transversus. When you see into the dissection of the bodies there, you see the muscles, some are open. So the external oblique, internal oblique, inside, and your transversus. And from here, when you read the thorax, we studied the thorax, there was serratus anterior, interdigitating in the thoracic cage. So this forms the belly or anti-abdominal wall. Okay. Now these muscles are originating from the hip bone. So this is the ear-shaped articular surface for the sacrum. Now sacrum is a single bone. It comes in between the two hip bones. Now the vertebra, 7 cervical, thoracic and lumbar, then sacral, but the sacrum vertebra all fused, coccyx. This is one thing. Another thing is that this is the articular surface for socket for the head of the femur to form the hip joint. Now this is the smooth surface, the iliacus muscle. Okay. When you see the iliacus muscle, the psoas comes here, the nerves and vessels are going from lateral to medial or medial to lateral. There's the interpose, the fifth vertebra. And this is the sacrum having two wings. And over here, the extension of the spinal cord goes. Basic concept. Now, in this tubercle, over here, anterior superior iliac spine to the pubic tubercle, inguinal ligament. In the dissected body, you will be seeing it. Inguinal ligament, everything. Now, it's like this. This is, you see the dead body. When you are reading the hip bone, you see the dead body and see the muscle orientation, how the muscles are orientation. Then there is an important known as inguinal canal or Hunter's canal when you dissect. Now, there's a pectinate line, the pectineus muscles. This is your the pubis, the superior rami, inferior rami, ischial tuberosity. It is the ischial tuberosity, the upper two semitendinosus, and the quadrant. This is a triangle area. This is a quadrant. This is separated by a ridge. So your now this obturator foramen is not so exposed. It's having a membrane, and this is symphysis pubis. In previous days, they used to if the baby got during delivery, if it got stuck, then they used to symphysotomy. They used to make an incision and just open the, make loose and open the your pelvis. So the smooth delivery was there. After that, the development of your cesarean section and all. So this you take and please see each part, the muscles, the important part, the injection, you give a deep intramuscular injection. There are some injection that is oil-based, that is painful. But many injections are there now coming up, that is aqueous-based. Aqueous means in water. So you have to, easy shot in case of an emergency, don't have to give a injection in the deltoid. Okay. Now you just hold the anterior iliac spine and you one palm like this. You put the injection here. You won't be injuring any important vessels or nerves. Means it can be a thin branch of a nerve that is supplying the muscles. Now we have the tensor fascia lata. If you stand like this, tight, you will see it is the tensor fascia lata. And over here, this inner surface is supplied by the iliacus muscle. It is not supplied, it is iliacus muscle is attached. Iliacus muscle is attached. And like you see in the USG report, they are now, the cecum is here, the appendix is here. That's a right iliac fossa, tender. Right iliac fossa tender is reported in the USG. Now, if you see from the umbilicus to the anterior superior iliac spine, the medial 2/3 and lateral 1/3, that is the McBurney's point. So if you press over here in the McBurney's point, Okay. Now, the McBurney's point is a definite point to approach for the appendix, inflamed appendix during surgery. Now, this is the upper rami, lower rami, and this is the obturator foramen. Obturator membrane is there, and your take it. এই যে আছে না gluteus maximus, minimus. This is the attachment of the right iliac crest as seen from above. Now you see the muscles, the external oblique, internal oblique, and transversus abdominis. This transversus abdominis from lateral to medial. Now you have to the sartorius in the front, gluteus maximus. If you taught your muscle, you go home and you see how it is. The feel, you have to know the feel and the areas where it is attached. Now it is. Then these muscles from the hip joint, when you study the hip joint, then the muscles are originating here from the pelvic bones. It will go to the destination is the lower knee joint, sartorius, Taylor's muscle. Taylor's muscle. I told you just in, when the attachment in the tibia. Now you have to build up a conception that what are the muscles in the iliac crest. So from external to medial, lateral to medial, external oblique, internal oblique, transversus, and in the posterior aspect, medial 2/3 and lateral 1/3 of the iliac crest. If you view from here, the gluteus maximus. Now, these muscles are going to the chest wall, these muscles going to the gluteus maximus, and the sartorius and semimembranous, semitendinous, these muscles go to the lower limb. Ho gaya? I'll put more this thing here. Please see, please see, please see. দেখো এমনি করে বসে থাকলে হবে না। হাত খোলো, ছোড়ো, হাত খোলো, দেখো। ওই দেখো, ট্যাব দেখো, হ্যাঁ। Feel it, এই দেখো, feel it. Please see, feel it. I'm here. He's presenting me the pelvic bone, that's the hip bone. Okay. He studied in the home, and he wants to present how efficiently he is going to present, we'll see. Okay. This you have to be brave. With your friend you interact like this. Okay, now tell me.
So this
এই আমি বলবো তোমরা পড়ে নাও, হ্যাঁ, দেখো, তারপরে নিজেদের মধ্যে পড়ো। এবার যদি কেউ বলে আমি কথা বলবো, আসো, তুমি ওর এখন দেখে লাভ নেই, পড়ে নিতে হবে। ইউ হ্যাভ টু অ্যাকোয়ার নলেজ। ইফ ইউ ওয়ান্ট টু প্রেজেন্ট ইট, আই এম দেয়ার। বলো।
So this is the hip bone of my right side. This is the anatomical position
Of your right side, no.
of right side.
Your right side and your hip bone, you're not saying.
Of right side.
No, it is off right side.
Right side. This is the anatomical position. The inner surface is medially and the outer surface is laterally.
Now, one thing you have not mentioned,
Acetabulum.
side
Identification.
that is important. That's important.
Identification is acetabular cavity is on the lateral side, facing laterally. So, starting with the bony prominences of the hip joint, this is the iliac crest. This is the anterior superior iliac spine. This is the anterior inferior iliac spine. This is the tubercle, ischial tubercle. Then this is the pubic bone, pubic
Ramus,
pubic
superior
ramus,
ramus,
superior pubic ramus, and
inferior.
inferior pubic ramus. This is the pubic bone, pubic tubercle, and pubic crest.
And your
This is the
medial.
CPL pubic surface. Symphysial pubic
Hey,
surface.
अविनाश मॉडल वाला चार्ट दिए थे हिप बोन नहीं देना प्लास्टिक
Pubic
गुलो
surface. And
हाँ
this is the inferior pubic ramus. This is the ischium pubic ramus. Ischiopubic ramus. This is the ischium. This is the lesser sciatic notch. This is ischial spine, and this is ischial tuberosity. This is ischial tuberosity.
now
Yeah.
ischial tuberosity
Infanta.
is
This one. This is the ischial spine, lesser sciatic notch, greater sciatic notch.
sciatic
Sciatic notch, greater sciatic notch, lesser sciatic notch. Then posterior, inferior iliac spine, posterior superior iliac spine.
now what is this area
This is the auricular surface where sacrum is attached to the hip bone.
it
It
articulates
articulates with the hip bone. And this is the medial surface, and this is the medial border of the hip bone. Here attachment is iliacus muscle, and on the outer side there is acetabular cavity along with the attachment of gluteus
muscles
muscles. Gluteal muscles. On the acetabular cavity, the head of the femur is articulate with the hip bone.
articulate head of the
Femur. Head of the femur articulates with the hip
now
bone.
what are the muscles attached on the anterior two-third and the posterior
That I have to see.
না ঠিক আছে